Hi, it's Brockton Hospital. Hi, we have a smoke detector first floor. It's a fire alarm. It says boiler maintenance building A building.
On February 7th, 2023, Signature Healthcare Brockton Hospital evacuated 162 patients to safety after a 10-alarm electrical fire broke out. The fire knocked out primary and emergency power, drove smoke into patient floors, and affected critical utilities such as medical gases, electronic medical records, and communication systems. Before describing what happened next, we want to introduce you to Signature Healthcare. The cornerstone of our system is Signature Healthcare Brockton Hospital, a 216-bed acute care teaching hospital serving more than 460,000 residents in 20 communities around Brockton, Massachusetts, just 30 miles south of Boston. With more than 2,700 employees, it's one of Plymouth County's largest employers and a community lifeline with roughly 11,000 inpatient admissions, 10,000 surgical cases, and nearly 500,000 outpatient visits annually. When the fire broke out, the hospital set up its Incident Command Center in the nearby School of Nursing and began coordinating with Brockton Fire Department. Fighting the fire meant shutting off all electrical power to the building, including generator power. With smoke and fumes in the building and no electricity, the hospital, along with Brockton Fire Department, made the call to evacuate. Brockton Fire Chief Brian Nardelli activated 10 alarms, pulling in personnel from nearby fire companies and ambulance squads to help move patients to safety and extinguish the blaze. In all, 91 ambulances, 26 fire trucks, including 8 ladder trucks, and nearly 300 emergency personnel responded. It was the largest fire alert in Brockton's history. Because the fire started during a shift change, extra staff were already on site to help care for and move patients, all without elevators, lights, computers, or phones. All major communication systems remained down for over a week. 15 hours later, and with no fatalities or injuries to staff, patients, or firefighters, the fire was out and all the hospital's patients were safe in other locations. It was a truly heroic achievement.
I was upstairs on one of the nursing units, and I witnessed the nurses who were extremely brave. I would say well-trained. They knew exactly what to do. It was a little chaotic, as you can imagine, but it was organized chaos. They were very patient-centered. They weren't worried about themselves. They were worried about the patients, getting the patients out safely.
I was worried about the staff as well, because I'll tell you, the managers, the nurse managers, supervisors, the AVP for nursing, they were running up and down 5 flights of stairs. They were assessing with the fire department where the carbon monoxide levels were high, and they were moving patients. I was concerned about them. You know, we didn't have access to elevators. We were so fortunate that, you know, there were no injuries, but that was really truly a worry when you start to think this is pretty significant.